We're here at the Kingston Collection in Kingston for the second annual Community Behavioral Health Fair. This year we have about 75 vendors, which is about 10 more vendors than last year, and it covers a wide variety of different things that we're looking for resources for people out in the community. So we have substance use disorder resources, mental health resources, a number of community resources from different public safety agencies to the district attorney's office, as well as youth and senior resources as well. So pretty much everything anybody could possibly want for services is here. We've collaborated with, brought more people in, so Plymouth County Outreach, Plymouth County Hope. They've worked with us a lot to be able to bring in more providers and push it out to get people to show up, and so it's just been great. As public safety responders out in the field, we're going to people's houses and there's a lot of crisis and things going on, and they're not necessarily aware of what's happening. So we try to hold this annual fair. It helps, we believe, reduce the stigma associated with getting mental health help and substance use help. It also helps with our providers to be able to network, because when they're trying to get somebody's services, they, sometimes they'll have to go with another different provider with something else. It might be somebody else in the home that needs something, and it's outside of their usual purview. Obviously, everyone knows that there's the opioid epidemic that's going on. It seems as though the tide might be turning a little bit, but I personally believe that it's due to a lot of the outreach efforts, a lot of the legislative efforts that have been put out by the governor and local legislators, with Narcan availability, programs, and like I said, I believe programs like this, everybody working together. They say it takes a village, and so that's what we're trying to do. And I think that people talking, public safety, organizations talking to providers and really working together is how we're accomplishing this. If people can come up and they can talk to me as a police officer or one of the firefighters and have like a real heart-to-heart conversation, or even just feel more comfortable reaching out and just talking to people. I think that, like I said, breaking down those barriers and getting help, it avoids us, hopefully in the future, from even getting to the crisis level.